Good evening, all of you. Just wanted to confirm if I'm audible and visible. Kindly confirm in the chat box if my audio as well as my visuals are all clear. Hi, Vaidehi. Yeah, very good evening. So, how are you guys doing? All good? So, welcome to one more session on MedEd Clinics. And I'm Dr. Jazeer, your dermatology faculty at PW MedEd. Thank you so much for confirming. So, I have a very interesting topic for you today. The topic that we are going to discuss today in MedEd Clinics is about approach to the red phase, diagnosis, and the management. So, you must have seen a lot of conditions where a patient can present to you with a red color face. So, what is this red face? What are the possible differential diagnoses of a red face, and how do we approach them during your clinical postings, and how do we manage them? That is exactly what we intend to discuss in today's session. Okay, so shall we begin? So basically the learning objectives of the day is that to identify the common causes of facial erythema, what we usually call as a red face, and again classify this facial erythemas into transient as well as persistent causes, and then learn about how do we do a clinical evaluation for a red face, and then understand what are the key investigations and treatment strategies. So this is exactly the plan for us. So before we get started, anybody in the chat box, before we start with any of the slides, does any disease come to your mind when I say red face? I don't say anything else. I just say red face. Anything comes to your mind? Few diseases, if to all of you who are listening to this lecture right now, if you could just drop in some of the diseases that comes to your mind, that would be great, just to understand what is the idea that you have when I say a red face. So the idea here is, Taufik says SLE rash. I completely agree with you, Taufik. Very good. So in the red phase, one of the very common differential diagnosis that comes to everyone's mind is SLE, malar rash. Anything else? Just give it a try, because I have many images today and we'll be discussing through these images about the various causes as well. Hello, let's begin then. So as an introduction, a red face is a common presentation in dermatology OPD. So it's very common because you can see it because of a lot of causes, like as you melasma. No, melasma mein na, we don't get a red face. Instead, we get a brownish hyperpigmentation over the face. I agree. In melasma also you will get it over the face, but the color is not red. Okay, that is the point to be noted. Okay, and it can be transient or it can be persistent, and the problem with the red face is anything over the face the patient would be way too concerned, right? That is why you get a pimple, you would like to get it sorted immediately. Any rash in the face, you will not wait, you definitely would prefer to get this sorted as soon as possible. So now let's start with the session. So let us begin. When we think about a red face, what are the causes of a red face? The causes or a classification we can divide, that the patient may have a transient red face. So what do you mean by a transient? It comes and goes. So what comes and goes, we can call it as flushing. Okay, we can call it as a flushing, because what happens here is this is going to be typically episodic. This is typically going to be episodic. Matlab it comes and goes, as well as this is going to be non-inflammatory. It's going to be non-inflammatory. That is how you can see. And what happens here with a transient kind of a flushing is that the patient may have multiple triggers. Let us say, what can be the trigger? The trigger can be an emotion, it can be an exercise, it can be a spicy food. So now you have an idea, right? What am I meaning? So यहाँ पे in transient causes of red face, We have multiple. Transient में we can have rosacea, which is again the patient's complaint can be flushing. The patient may have a carcinoid syndrome. The patient can have a carcinoid syndrome, as well as the patient may have mastocytosis, cutaneous mastocytosis like urticaria pigmentosa and all. So the patient may have a transient kind of a flushing. In which diseases can you find a persistent erythema? The second one is persistent erythema. In persistent erythema, just like somebody was answering in the chat box, like SLE, there is a persistent erythema. It doesn't come and go. It is present in the skin, right? Similarly, it can be seen in seborrheic dermatitis, etc. There are many causes of a persistent erythema. When I talk about any infectious cause of a red face, does any infection come to your mind? जैसे a disease where you get a honey colored crust, but यहाँ पे you also find that there is some erythema. It can be like impetigo. When does the face turn red in color with a well defined border? It is called as erysipelas. This can be seen in erysipelas as well. And in children, let us say an infection because of a parvovirus. So what is that? Excellent. Yeah. Parvovirus infection matlab, yeah, like this. What is that? Slapped cheek appearance, right? Slapped cheek appearance. It's called fifth disease. Fifth disease because of parvovirus, as well as it can some drugs can also cause redness. Now, which drug? It is usually caused due to a topical steroid withdrawal. This can be caused due to topical steroid withdrawal, as well as we can have it because of ACE inhibitors. Okay, some drugs like niacin, ACE inhibitors and all, they can also cause this kind of facial erythema. Very good. Red man syndrome. Excellent. Red man syndrome is also one where you can see that there is a reddish discoloration over the upper part of the trunk, right? So that can be seen. A very good, very good answer. That is basically a histamine reaction to vancomycin infusion, right? To vancomycin infusion. So all these things can be like vancomycin, red man syndrome. Excellent. So all these are going to be the causes of a red face. So now let's see how are we going to do a clinical evaluation of the same. So in the clinical evaluation, just as you know, you always will have to take a good history to understand like when is the onset, what is the duration of the rash, etc. So you have to ask like when did the rash first appear and for how long is it present? Is it going to be an acute erythema or a chronic erythema or something like that? Or does the patient feel there is some triggers? Is there some triggers associated or not? So that also you need to think. And is there any other family history or associated symptoms? All those things. Okay, family history and associated symptoms, etc. So all these things has to be evaluated. All those things has to be evaluated. So now what we will see is, let us jump and see multiple images now. So in the history and all, you all know, okay, what are the things that we are going to ask and everything. But now we also will look for the distribution, like whether it is present over the cheeks area or is it present uh, throughout the face, etc. So distribution and all, sometimes some rashes can be only central, some can be malar rash, isn't it? So it can be different kinds. Some rashes it can be periorificial or it can be perioral. So all these are going to be the different types of distribution of the rash. Correct? And along with that, we have to see what is a morphology. Like morphology means there would be redness along with, is there some scaling that is present? Isn't it? So is there any telangiectasia that is present? So what are the associated morphology of the lesions, that also we will have to understand. And of course, we will also have to see some pediatric specific patterns, like in children, like what you can see in measles and all. Some specific patterns, like the pattern that we can see in measles. What do we call for the type of rash in measles? We call it as an exanthematous rash, or we can call it as a morbilliform pattern, or we can call it as a morbilliform pattern. So all these are going to be the different types. Now comes the most interesting part. Now let's go to the key differential diagnosis. Now what I have done is I have given you an image of a condition. I'm going to describe कि a patient का complaint भी क्या है. So you just see what is the complaint of the patient and try to answer me in the chat box कि diagnosis क्या हो सकता है. So let's see the first question, that is 35-year-old with flushing papules, telangiectasia on the cheeks, worsened by spicy food and alcohol. So what is the answer here? So I'll just zoom this image for you. So in this image, you can see that if I zoom it further, I can see very well see that there is, dilated blood vessels can be seen, isn't it? So these dilated blood vessels are called as telangiectasia. So there is a 35-year-old patient who is complaining of redness over the face along with flushing. Flushing is the very important symptom here. So based on these symptoms, can you tell me one single best diagnosis here? Anyone? So please try to answer this one. It's a very, very typical symptom that I am mentioning here. So here the diagnosis should be rosacea. So here the diagnosis should be rosacea. And to be very specific, this should be erythematotelangiectatic type. In fact, this is the most common type of rosacea that you can see. Okay, this one is going to be rosacea. And this condition, the patient usually complains of flushing. And very importantly, the symptoms are worsened by spicy food, alcohol, or even hot beverages. So if a patient is telling that every time I take a tea or coffee, my redness over the face and the flushing worsens, or every time I consume some spicy food like pickles and all, the symptoms is going to get worsened, then this is called as rosacea. So this is going to be one of the key differential diagnosis, and it is very easy to make out because when the patient will give you a proper history along with the proper clinical examination, आपका diagnosis होगा rosacea. So shall I move to the next one? So moving to the next one. A 28-year-old with greasy erythematous scaling in the nasolabial fold as well as the eyebrows. Now you see this one. Here the patient is saying that there is a persistent swelling, persistent redness. You can see that there is a redness over this area. So there is a redness of the skin. Along with this redness over the skin, you can see that there is a yellowish greasy scaling as well. Now can anybody answer this one? काफी typical है because I've told you it's seen in the nasolabial folds, eyebrows. If you want, I can give you more clues that this can also be seen over the scalp, as this is the most common site of this disease. The scalp is the most common, but we can see a facial erythema over the eyebrows, over the nasolabial folds, even behind the ears, over the anterior part of the sternum. So all these are going to be additional. Impetigo नहीं है, because why it is not impetigo? क्योंकि impetigo में you can see honey colored crust, isn't it? यहाँ पे कोई crusting नहीं है. This here what we see is scaling. Okay? Here what we can see is scaling. And if you want one more clue, I can say that this is caused due to a commensal yeast. It is caused due to a commensal yeast. What is the name of this commensal yeast? It is also called as the Malassezia furfur. Now I guess you should be very close to the diagnosis. Yeah, Aapka fan, Taufik, all of you are answering. Here, the diagnosis is going to be seborrheic dermatitis. Seborrheic dermatitis. So in this type of seborrheic dermatitis, because of this yellow greasy flaking, the patient would be having in the scalp. It can be over any of the seborrheic sites, including the eyebrows, behind the ears, nasolabial folds and all. Very common. Okay. So when you see a persistent erythema like this along with scaling, think about seborrheic dermatitis. So now moving to one more example. See what actually happens with a red face. Let's see this question. 40-year-old woman, butterfly rashes over the cheeks. And why do you call it as butterfly rashes? And there is a sparing of the nasolabial folds. काफी typical history है, or the patient can also complain कि मुझे ना joint pains भी हो रहा है, and there is a lot of photosensitivity. Every time the patient goes to the sun, the patient feels that redness and photosensitivity symptoms are there. Yeah. So this one is a very straightforward thing, which is called as the systemic lupus erythematosus. Here you can see many other symptoms also. Okay, so you can see photosensitivity is just one of the symptoms. You can find aphthous ulcers as another symptom. So a lot many symptoms can be seen, and you will also investigate the patient, isn't it? So you'll investigate the patient if she is having anti-nuclear antibody, and you know that this is a condition which is more common in females than males. So all these are the findings in systemic lupus erythematosus. So now let's see one more. Now, let me see who gets this right. I'll just look into the chat box now. A 45-year-old patient is presenting to you with a violaceous. Matlab, violaceous means the color is going to be purple colored, right? So there is a purple colored periorbital rash, and it's mentioned that it is looking like a heliotrope flower. It looks like it's compared to a heliotrope flower. The patient also complains of muscle weakness and photosensitive skin changes. Yes, I can see the right answer in the chat box. Excellent. यहाँ पे diagnosis हो गया. See, there are skin symptoms. Along with the skin, there is muscle weakness also. So skin plus muscle is equal to dermatomyositis. So you can see there is dermatomyositis. Now see this facial erythema. This is how a patient can present to you with dermatomyositis. Like once they close their eyes, you can see that there is an entire erythema, and this one is compared to a heliotrope rash. It is compared to a heliotrope rash. There are a lot of other features that you can see in dermatomyositis, because the patient can say there is muscle weakness. You can see a lot of photosensitive skin changes. What are the photosensitive skin changes you can see? You can see shawl sign. You can see a V-shaped erythema of the anterior part of the chest. Anterior part of the chest. And we can see a lot many other signs as well. So the other signs what you can see here is like the Gottron's papules that is seen over the hands, isn't it? So in Gottron's papules, what happens? You can see that there is a erythematous plaque lesion over the joints, okay, over the joints, like the interphalangeal joints and all. You can see that there is a rash, but the area in between the joint spaces, it is going to be spared. That is how you can diagnose Gottron's papules. So along with Gottron's papules, you can see a lot of changes, like let's say nail bed telangiectasia, Holster sign can be seen, or Holster mechanics hands. All these can be seen in the case of dermatomyositis. Can be seen in the case of dermatomyositis. So moving to another one, Now, what if you get a patient who is having a red color face? Now, you are asking the history and you get to know that it's a 22-year-old patient who is having this red colored itchy papules. So till now, it was red color was present, but it was not itchy. Now, if you find there is a itchy papules and after using a new cosmetic cream, so the patient will say that I bought something online, yeah, I bought something from the store recently. After using this one, I started developing this kind of a rash, and the rash is going to be itchy. So when you find there is a itchy kind of a rash, always think about allergic contact dermatitis. So what is the patient allergic to? The patient may be allergic to some. Yeah, very good. So, uh, yeah, please don't answer it as irritant contact dermatitis. The reason is irritant contact dermatitis is usually caused due to chemicals. But anything other than chemicals, like you forget about detergents, you forget about dishwash, sanitizers and all, but remaining everything, it falls under allergic contact dermatitis. So in these kind of patients, when the patient says कि कुछ cosmetic cream use करने के बाद ऐसा rashes आ गया, and yeah, these rashes are going to be very itchy and there is some oozing and all those things from the lesion, my face has turned red in color. So when you find all these things, you can ask the patient to do an investigation which is called as a patch test, which is the investigation of choice when it comes to a patient with allergic contact dermatitis. Is that clear? Chalo. So now let's see another example. A 26-year-old female with a small erythematous papule around the mouth and the chin, pairing the vermilion border, and there is a history of topical steroid use. There's a history of topical steroid use. What is the answer going to be here? What is the answer here? So anyone in the chat box, please. See, what happens here is because of prolonged steroid use, the patient can get a diagnosis which is called as, anyone who would like to give a try in the chat box. I'll just give you a few more seconds. If you're not able to do it, just see that there is a patient. So there is a sparing of the vermilion border and there is some erythematous lesions which can be seen around the mouth, and around the mouth is the clue for you. Okay, something that is around the mouth. So this one is called as perioral dermatitis. So this one is called as perioral dermatitis, where you can find some papules around the mouth and it spares the vermilion border. Okay, so this can be seen as papules around the mouth. Now, why does this patient develop these kind of things usually? The patient may develop this due to prolonged steroid use. Due to prolonged steroid use. That is how a patient can develop these kind of lesions over the skin, and that would, and because of overuse of steroids, what can happen, there can be a super added infection. That is why we may require the patient to be treated with doxycycline or minocycline and all, isn't it? That is how we can treat this patient. So now let's go to the next one. The next one is a 6-year-old child with a fever and sudden appearance of bright red cheeks. So in any child who complains of fever along with a bright red rash, especially over the cheek area. So the key term here for me is going to be this fever and a child. So if child with fever and red face, then we always think about which disease? No, but some of you are right in the chat box. Yes, it is due to parvovirus. अब ये कौन सा infection है? There is a viral infection by parvovirus, and this is called as the fifth disease. It is called as a fifth disease. In fifth disease, what do you see? We get a slapped cheek appearance. Slapped cheek appearance. In fact, this slapped cheek appearance, we also call it by an erythema in dermatology. So what is the name of this kind of an erythema where a child can develop erythema along with fever in the face? Yeah, this one is called as erythema infectiosum. So this one is called as erythema infectiosum. Yes, it's not marginatum because we have a lot of erythema in dermatology, right? So it is okay if we make some mistakes, but remember erythema marginatum rheumaticum that was seen in rheumatic heart disease, whereas erythema infectiosum is seen in fifth disease caused due to parvovirus. Okay? So no worries making mistakes. It's fine. The best thing is that you are learning, isn't it? You are learning now. Shall I move to the next one? So moving to one more, that is a 4-year-old child who is having fever, cough, conjunctivitis, and coplic spots, followed by a widespread morbilliform rash. So this is a rash. See, you can see that the skin has turned red in color, and this type of an exanthematous rash, we call it as a morbilliform rash. And here the patient is not only having a fever and a rash over the cheeks was fifth disease, but fever along with cough, coryza, running nose, all those things together, conjunctivitis as well. So here, what is your suspicion? Yeah, very good. So here the diagnosis should be measles. So here the diagnosis should be measles, which can be the right diagnosis in this case. Clear? Because all the typical things that we have mentioned, like fever, exanthematous rash, which we also call as a morbilliform rash, conjunctivitis can be seen, cough can be seen, coryza can be seen. All these things are exactly typical for measles. Okay. Sure. So now that we have understood that there are many diseases where you can find these kind of red face, but you must have understood by now that her patient का history is going to be different. Okay, somebody complains कि मैंने काफी टाइम से एक steroid creams use कर रहा था और steroid creams stop करने से ही I got these kind of papules and erythema. You always think about around the mouth. You always think about perioral dermatitis. Anytime the patient is saying, whenever I go to the sun, I'm getting a lot of photosensitivity and there is a erythema sparing the nasolabial folds, that gives you a history कि हाँ ये SLE हो सकता है. So similarly, if a patient is saying कि there is a lot of dandruff in my scalp, now my skin of my face is also showing a lot of whitish, yellowish, greasy flaking over the skin, that will give you a clue that the diagnosis is going to be seborrheic dermatitis. In some cases, when the patient says that whenever I'm consuming pickles or hot beverages and all, काफी ज़्यादा flushing symptoms होता है and my face is red in color, you think about rosacea. So every case is having a different presentation. That is how you can reach out on a provisional diagnosis based on clinical presentation. But anyways, to confirm the diagnosis, we will also have to go for multiple investigations. So we do all the routine, like we'll check the CBC, ESR and CRP. So whenever you are suspecting something like a dermatomyositis or an SLE and all, you can go for investigations like anti-nuclear antibodies, anti-dsDNA, anti-MI2, etc. So when you suspect कि ये कोई allergy की वजह से होगा, so in those cases you can go for patch testing, isn't it? And if you see that the patient का जो vesicular lesions है, especially this gets confused with like if you have a confusion, is it impetigo versus herpes simplex infection? मतलब herpes let's say labialis. So in herpes labialis, you may get confused. If the patient is having some vesicular lesions around the mouth or around the lips, or is it because of impetigo? So for such cases, you can also go for a Zang smear. So in Zang smear, what happens? So when you do Zang smear, you can see multi-nucleated giant cells when it comes to HSV or varicella or varicella. And the last one is whenever you are in doubt or if you want to confirm a diagnosis, then you can go for a skin biopsy as well. And only if it is necessary, you may go for some viral serologies, but otherwise measles and all usually can be diagnosed clinically. Clear? So these are the kinds of investigation that we can do. We can go for any routine investigation, patch test, we can go for Zang smear, all those things can be done. So now how do we treat this patient? Because when it comes to the treatment, we always will have to treat the cause. अगर seborrheic dermatitis है, then please give anti-dandruff shampoos like antifungals like selenium sulfide, clotrimazole, etc. If it is going to be because of allergic contact dermatitis, then we probably will have to use a mild steroids. So depending upon the diagnosis, if there is a lot of photosensitivity, we ask the patient to take sun protection. How? By applying sunscreens and all. So that is how we can go for a treatment overview. And there will be specific treatments also. Like in the case of rosacea, you can see that the KOH may show some Demodex mites. So when the patient is having some Demodex mites and all, if you apply metronidazole gel, it shows an excellent reaction or excellent response to treatment. So in seborrheic dermatitis, we can go for ketoconazole shampoo or lotions along with selenium sulfide lotions and all. And dermatitis, as the name says, it is usually treated with steroids. But if you want to avoid the long-term steroid side effects, you can also definitely go for calcineurin inhibitors. So what are the calcineurin inhibitors? Like this is going to be tacrolimus or pimecrolimus can be used. Okay, tacrolimus or pimecrolimus can be used. So that is all about this very short topic in dermatology where you get a patient with a red face. So remember, red face can cause due to various causes. We have discussed key what are the different common causes where you can see a red face, and always have some considerations. Okay, age kya hai? If it is a child, more likely to be fifth disease. If it is an adult, it is likely that it can be autoimmune or it can be diseases like dermatomyositis, etc. So we have to take a proper history and a good physical examination, which is absolutely mandatory here. And then investigations वो dependent है क्योंकि based on the clinical presentation you can decide on what are the investigations which has to be done in this case. Okay, so that is all about thank you so much, Apka fan, and that is all about today's session. So do go back to the PW Meded app and explore the clinical corner where you can see a lot of cases and its common presentations and all. So that is how you can be a better doctor and try to apply these kind of concepts that we learn through Meded clinics during your postings as well. And I'm coming back again with multiple new topics as well. So thank you so much for being a very interactive crowd and answering all the questions. I guess I'm coming within the next 2 days. I have another topics that is lined up. Okay. So thank you so much, all of you, and have a great evening. And we'll be having more and more such sessions very soon.